Hi, today we gonna talk about pleural diseases. That they are pleurisy, pleural effusion, and pneumothorax. First, pleurisy, or dry pleurisy, because it is inflammation of both layers of pleura, but without liquid or air inside it. The cause is often infection of lungs, as bronchiectasis, or pneumonia, or secondary to them, plus lung abscess, and tumor, or after radiation exposure, or secondary to systemic lupus erythematosus, or rheumatoid arthritis. The patient with pleurisy will come suffering from chest pain, that is the commonest, and increase with inspiration, and decrease with holding the breath, and dry cough, and dyspnea. And on examination, we hear pleural rub. Hear the sound. Listen in between the breathing. It's more like cat purring, if you gave an example. Second, pleural effusion is an accumulation of fluid in the pleural space, more than normal range, 10 to 20 milliliters. The cause is infection, or increased blood perfusion to pleural space, leading to accumulation of fluid, or injury that accumulate the blood, but then called hemothorax. Symptoms are depending on the rate of accumulation, so, it could be asymptomatic, or could be chest pain with dyspnea and cough. On examination, we find bulge on affected side, diminished respiratory movement, tenderness due to compression, and shifted trachea to opposite side, and stony dullness on percussion, and decreased TVF. Pleural effusion has many types. One of them is empyema, that means pus in pleural space, due to infection or pneumonia or TB. Finally, pneumothorax, that is the presence of air inside pleural space. And the cause may be complicated of pre-existing pulmonary diseases, as COPD, or bronchial asthma, or could be physiologically in tall young patients, or the cause may be traumatic, like after pleural biopsy. Pneumothorax types: open pneumothorax, and closed pneumothorax, these two is mild. Tension pneumothorax is a life-threatening condition, due to the continuous increase in the pressure of pleura, and the compression on lungs. The patient mostly suffering from chest pain, dry cough, dyspnea, and may shock if tension pneumothorax. On examination, we find tachypnea, tachycardia, hypotension, and bulge on affected side, and diminished respiratory movement, and shifted trachea to opposite side, and decreased TVF, and hyperresonance on affected side, but if tension pneumothorax, tympanic on affected side on percussion. Finally, thanks for listening. That was all today. I hope you learned something. Thanks again and subscribe for more.